Welcome, everyone, and let's jump straight in. Today, we've got a highly crucial explainer lined up for you. We're doing a visual deep dive into the insights of Dr. Isero, an expert specialist in urology and gastroenterology who literally sees over 30,000 patients a year. We're unpacking a medical condition that is incredibly misunderstood, frequently overlooked, and absolutely dangerous: pancreatic cancer. Through Dr. Isero's clinical experience, we're going to decode the earliest warning signs of this disease. This is all about equipping you with the exact knowledge you need to figure out what your body might be quietly trying to tell you.
Okay, let's dive into this. 5%. When we're talking about a 10-year survival rate in the medical community, we mean the percentage of folks who are still alive 10 years after their initial diagnosis. For pancreatic cancer, that number sits at an absolutely chilling 5%. It's a statistic that immediately demands our respect. But to truly grasp the weight of that number, we've got to put it into perspective. Because the contrast here is just stark. Look at a disease like prostate cancer, where the 10-year survival rate is a highly encouraging 84%. And actually, the average survival rate across all types of cancer is roughly 60%. So why on earth is pancreatic cancer all the way down at 5%? Well, the answer lies in how incredibly late it's usually discovered. Because it hides so well, by the time standard symptoms finally show up, the cancer has often advanced significantly. That's exactly why early detection isn't just important here, it's quite literally a matter of life and death. So here is our roadmap for decoding these clues. First, the silent organ. Second, persistent pain. Third, sugar and weight changes. Fourth, bodily color changes. And finally, how to take action. Starting with section 1, the silent organ. Why it is so incredibly hard to detect.
The official medical term for the pancreas is a retroperitoneal organ. But what does that actually mean for you? Well, picture your abdomen, your stomach, your intestines. They're all wrapped up in a nice protective lining called the peritoneum. But the pancreas? It's not in there with them. It sits completely behind that lining, tucked incredibly deep inside your body. It's actually much closer to your back than to your belly. Because of this super deep anatomical positioning, it acts as a perfect, quiet hiding spot for a tumor. A mass can just sit there and grow for a long time without bumping into other structures or causing obvious outward lumps. This naturally delays any obvious symptoms. It is, quite literally, suffering in silence. Moving to section 2, persistent pain, that relentless dull ache in the back. Now, what's really interesting about this comparison is the distinct difference between how we experience everyday pain versus internal organ pain. When folks feel a pain in their back or the pit of their stomach, the epigastric region, they almost always just brush it off, right? They assume it's a pulled muscle or maybe a bad stomachache. But here is the key: muscle pain changes. If you twist or stretch or lie down, a muscle strain shifts in intensity. Internal organ pain, especially from a distressed pancreas, doesn't care how you move. It presents as a relentless, constant, dull ache that stays exactly the same whether you're sitting perfectly still on the couch or doing jumping jacks. If you have a dull ache like that in your back or upper stomach that simply will not shift, your body is raising a massive red flag. Section 3, sugar and weight changes, the hidden metabolic warning signs. To really understand this, we have to mechanically demystify what the pancreas actually does all day. Let's break it down into steps. First, your pancreas is a factory that produces insulin. Second, that insulin acts like a little delivery vehicle. It grabs sugar from your bloodstream and carries it directly into your cells to give you energy. But step 3 is where the danger lies. If a tumor begins destroying that pancreas, it totally disrupts the production of insulin. Suddenly, all that sugar is just trapped in your bloodstream with absolutely nowhere to go. This means a patient might develop sudden onset diabetes or experience these massive blood sugar spikes out of nowhere. If your blood sugar spikes and you haven't even touched your diet, your pancreas might be sending out a biological SOS.
And tied directly to this metabolic chaos is unexplained weight loss. See, as a tumor grows, it quite literally steals the body's nutrients for itself. We can actually map out the exact mathematical danger zone for this. We're looking at a time frame of about 6 to 12 months. The major warning sign is losing 5% or more of your total body weight. So say a 60-kilogram person drops 3 kilos. Now, 3 kilos might not sound like a crazy amount, right? But consider the condition. This is happening while eating entirely normally with zero dieting. As we age, our metabolism naturally slows down. If you're eating the exact amount of food and losing weight without even trying, I hate to say it, but that's not a lucky metabolism. That's a mathematical alarm bell that you absolutely must not ignore.
Section 4, bodily color changes.
the visual warning signs.
Let's break down the gastroenterology plumbing here so this makes total logical sense. Step 1. Your liver produces a substance called bile, and that is what gives human waste its typical brown color. This bile travels down a tube called the bile duct, which actually passes right through the head of the pancreas to get to your intestines. Step 2. If there's a tumor in the pancreas, it can clamp down and block that bile duct completely, which leads to step 3, because the brown bile is trapped and can never reach the intestines, a person's stool will turn completely white. It is a terrifying symptom to see, for sure, but mechanically, it makes perfect sense. The color supply has literally been cut off. Which brings us to what actually happens to all that blocked bile. Dr. Acero shares a really chilling clinical anecdote about this. He saw a young woman in his clinic, late 20s. She was thin, didn't smoke, zero obvious risk factors. She came in complaining that her stomach felt a bit bloated, what doctors call ascites, or fluid buildup. And then she mentioned super casually, recently I was told my ears look yellow. Dr. Acero immediately ordered a CT scan. Tragically, it was advanced pancreatic cancer. That yellowing she experienced is called jaundice. When that bile is blocked from going down into the intestines, it has to go somewhere, so it backs up into the liver and spills directly into the bloodstream, eventually turning the skin and the whites of the eyes yellow. And that brings us to another absolutely critical color change you can easily monitor at home, your urine. That backed up bile we just talked about contains a compound called bilirubin. When it spills over into your bloodstream, your kidneys panic and try to filter it out. This acts as a massive biological red flag, turning a patient's urine completely dark, almost the color of dark tea or cola. Now, people see that and often think, oh, whatever, I'm just a bit dehydrated. But listen, if you are drinking plenty of water, you're fully hydrated, you haven't taken massive doses of vitamin C, and your urine is still persistently dark, that is bilirubin. In fact, standard urine tests at the doctor's office are specifically looking for this. Dr. Acero recounts a wild story from his time at a large hospital. A junior doctor ran a routine urine test on a patient. The rapid results came back showing some protein, white blood cells, and a marker that clearly read bilirubin 2+. Well, the junior doctor totally overlooked it, thinking it just wasn't a big deal. Later on, that same patient went to the gastroenterology department and was diagnosed with a severe bile blockage, highly likely linked to a tumor. The attending physicians were absolutely furious, shouting, "Why did you ignore the bilirubin?" It is a stark, real-world reminder that bilirubin in the urine is never, ever normal. It is a loud, flashing warning sign. Section 5. How to take action. The critical next steps. So the crucial point is exactly what you do next if you or someone you love who notice these clues. First and foremost, never ignore persistent dull pain in your back or stomach, and do not brush off unexplained color changes in your skin, stool, or urine. Second, get to a doctor and specifically request an ultrasound, which is also known as an echo scan. Third, for deeper, much more comprehensive imaging, request a CT scan. Remember, because the pancreas is hidden so incredibly deep, standard x-rays just will not do the trick. You need these specific imaging tools. Finally, ensure the clinic or hospital you visit is properly equipped for gastroenterology. You want to be in a facility that has the right technology and the exact right specialists to hunt for this silent threat immediately. We've unpacked Dr. Acero's clinical guidelines, the deep hidden anatomy of the pancreas, the relentless pain that won't shift, the metabolic chaos, and those glaring bodily color changes. The human body is amazingly resilient, but it also has profound, quiet ways of asking for help long before things become critical. So the question I'll leave you with is this: are you listening to the silent alarms? Paying attention to those quiet clues today might just be the exact thing that saves your life tomorrow. Thank you so much for joining me for this explainer, and please stay vigilant out there.